So I could say that I heard about the EMR through colleagues, right? So when I was in that process of opening my practice, I asked around to different friends that were in the same process, and some names of different EMRs came up. This one, Optivate, being one of them. Gus, which is one of the, I guess co-owners in the company, he actually met me on a Saturday and showed me the EMR, and that interaction with, being able to talk to someone within the company that is very responsive, that means a lot to me. uh, you know when we are seeing patients, sometimes we have issues, we need the issues solved right away, and they have been very good at that. So I think going back to the whole responsiveness, being having patience with you know, a doctor like me who's opening a practice, who's certainly concerned about cost, about, all what it entails to open a practice. I like that they had, the EMR, the practice management program, as a solution. I don't know, I just like the interface better. It worked for me. So that was mainly the reason I went with them. I would say yes, like I said before, I don't recall any time that I have called their helpline support line where I don't get someone right away to help me. Again, I do have what I consider a friendship with one of the partners and they're always very willing to call you after hours for any concerns. So, yeah, I mean, that's going above and beyond, right? You're calling when you're, with your family and to talk to some doctor. It's our EMR, so we, input all the data there. We upload all the images into the EMR. I have what we refer to as a server-based EMR. You can have it in the cloud or in a server. I do have a server in my office, so I think the images tend to be uploaded a little quicker. Also, if we don't have internet, we can still see patients because our EMR is housed in our office. But we use everything, the EMR, I mean, we use the entire solution, right? We recently added what they call the Axon system, where, you can capture patient demographics, I guess electronically via text message. We can send text messages, we can send lots of different things that make our life, easier. Since I've been using the EMR for a long time, I don't have a frame of reference, but, with the updates and things like Axon, things like being able to upload patient demographics into the new patient node, not having to input it by hand, that allows us to move. Again, it's all efficiency, moving faster, being able to accommodate more new patients, because it would take a lot of time to my technicians, I apologize, to input all that data. And my patient population is older, right? Some of these patients have 10, 12, 15 medications. So if we can automate that everything is completed, filled, it's just an upload, it makes a huge difference. In the end, the whole billing cycle process really begins before the patient gets to your office, right? That's the most important part. That's what I tell all my colleagues. You have to verify, benefits, know how much the patient is going to owe for the visit, and try to collect that beforehand. And that information you can get it from the practice management, right? And we recently implemented their automated payment system, POP system. I don't know if you, but so now the software automatically, when somebody has a balance, will text the patient can pay on their phone, and the software automatically post it. Again, those are little efficiencies. You want to make you want to give your patients, you want to make it very easy for them to pay you. If that makes any sense. If somebody has to sit down, write a check, and mail it to you, it's going to take them, they're not going to do it. If you just send it a link, they can pay it very quickly. And that way you can keep the revenue moving, you can expand, pay your employees, run a business. It's just being seamless, just making the worst part about being a physician is dealing with insurances, the paperwork, the administrative tasks. So anything that can make that easy, standardized, that anybody can come into the team and quickly learn how to do it, will make you, me, happy, and the staff happy. Regardless of which EMR you decide to go with, you should certainly try them out. In settings like the American Academy of Ophthalmology, you'll have plenty of chances to go and play with the EMRs. That's one. Two, that they have different options for you from cloud-based to server-based, where you actually keep the data in your office. And you have to get to know the people within the company, see if their interests align with yours. There's so many stories out there of people that their medical record companies either closed down or something happens, and then they have no access to the data of their patients. So that to me is very important, and it's hard to figure out, but it's important that you at least ask the question.